Okay, folks, well, we're going to spend the next 30, 35 minutes, whatever, reviewing with you VIA benefits. I'm going to go off camera for this session. We'll just hope that the issues that I've had so far during the day at least don't happen again for the next 30 to 35 minutes. So we will take it from there. Hopefully you can all see the screen. So we're going to be speaking about preparing for healthcare and retirement with Wespath's partnership with VIA Benefits. So we're going to cover who is VIA Benefits. There's going to be some introductory information in the beginning. And then we're going to have some kind of repeat and more in-depth information towards that third bullet, steps that you'll take. And then we'll review the health reimbursement arrangements, the HRA, a couple of ways in which the HRA can reimburse you for episodic periodic expenses or set it up to just actually do a premium flow on a monthly basis for you. We're also going to cover Medicare basics, kind of high level, just kind of a reminder of the various types of plan, parts of Medicare, Part A, B, C, D, that kind of thing. So who is VIA Benefits? VIA Benefits is an organization that has been around for 18 years. They are in their 18th successful year providing their services. They are the first and largest private Medicare marketplace. And that word is a critical word because this is a marketplace. They are not an insurance carrier themselves. But what they do is they work with organizations and employees, retirees within those organizations to match that individual, that household up best with the plans that can provide support for the Medicare activity that will occur for your healthcare over time. There's 2.3 million people that are already in the plans, and they partner with over 120 insurance providers. I'm going to mention that again in another slide where we can see some of the logos, the brands of those insurance carriers. Many of those ones are the ones that you would recognize. However, they also partner with ones that are more local, like we may not know nationally, but you may be familiar with in your local area. So they've got that full database, if you will, of 120 more insurance providers or insurance carriers. Now, as I said, they are a healthcare advocate in the insurance marketplace. So they themselves are not an insurance company. They are helping you navigate the marketplace. And really, like an underlying theme for this would be that at this point, you're actually acting like a consumer, and you're going to have tools and the ability available to you to start doing some shopping, start doing some comparing, and start determining, again, what would work best in your situation. As far as it is with Wespath, we started a relationship with them in 2012, and up through 2024, we have 33 plan sponsors that we are co-working with throughout Wespath and with VIA Benefits. This translates into over 9,000 eligible members. And what's really interesting about this is it actually has over 1,000 unique plan designs. So the plans chosen. So again, it's not a on the shelf, take it off. This is actually something that you will be able to tailor for yourself. And again, they use over 100 different insurance carriers. So here where VIA Benefits comes in, is they are providing you with the individual support to navigate what is this marketplace. Again, they are not the insurance carrier. They are not an employer type of arrangement or environment. What you'll need to do to start to utilize VIA Benefits as a resource, as a source, as a provider of the benefit of the services, you have to enroll in Medicare. So when each of you determine it's time to get into Part A and Part B of Medicare, and everybody's a little bit different, but once you're there, that's when you can start to use them. And then you'll select a supplementary plan with the one-on-one support from VIA Benefits. People go into this Part A hospital, Part B medical, and then there's the gaps, and they can help you determine what is the best arrangements for you to fill in any coverage gaps that you have and the cost sharing and cost savings that goes with that. Once your carriers have been determined to provide you with the insurance you're looking for, you'll be paying premiums to them. But again, you have the health reimbursement account or arrangement that will provide support to you to handle cost reimbursements and certainly premium reimbursements through the course of the calendar year. And they're a service that's always out there for you to reach out to for assistance. And this assistance is not just when you're doing the initial enrollment or each year during quote unquote open enrollment. It is actually during the course of the entire year, they are a resource for you to use. So how VIA Benefits can help? They have a very in-depth consultative process. They will work with you and you will provide to them your medical history, your doctors, any specialists that you use, the prescription drugs that you use, the preventive medication drugs, and maybe some drugs that you use periodically or most recently, just to kind of give a good profile of where you are as an individual. They actually have a simplified selection process. It is done through one of their advisors, but you'll also hear about the ability to do it online. And it's an effortless enrollment. They will work with you on the phone. You can get all the information to them over the phone, and then they will start submitting all the analysis, all the comparisons and all to help you determine what is the best environment for you to go into for your insurance, dental insurance, vision insurance, etc., and then help you with that enrollment. And then again, there is that ongoing advocacy. It's not where you're just going to get in and work with them from, October through December, and then after that, they're not available. They are available to you throughout. Now, again, this is a 4-step process. It's very hands-on. You're working with one of their advisors or counselors, but there is a way in which you can do all of this online. And there's a help you choose tool, and these are my doctors type of portal where you can actually self-serve yourself to get yourself established with the carriers that you want through the VIA Benefits portal. Now, some basics of Medicare. Well, Medicare, the original Medicare is Part A and Part B. It's a healthcare program. It's run by the federal government, as we know. Part A is for hospitalization and Part B is for medical coverage that you have. And throughout the course of, your SECA contributions or FICA contributions, we have been funding our participation in Medicare through our employment years. It is for individuals that are 65 years and older. However, some pre-65 individuals can qualify for Medicare. Those with long-term disabilities, where those disabilities have actually also gone through the Social Security disability income arena, and you have that long-term disability, then you are eligible for Medicare. Those with end-stage renal disease, Lou Gehrig's disease, ALS, those also have more or less an immediate enrollment into Medicare. Now, Medicare is administered by the Centers for Medicare and Medicaid Services. They're the oversight body. They are the regulatory body that oversees Medicare. However, the enrollments themselves are actually handled by the Social Security Administration. So it's really the infrastructure is in place with our Social Security numbers and how everything flows through SECA and FICA taxes. So we utilize that to take advantage of the enrollment into the Medicare plans. And the Medicare allows you to see any doctor or hospital that accepts Medicare. But when we get into the different types of gap arrangements that are available, some may be limited networks for access to doctors, and some may be more broad. With Medicare, again, the original Medicare, it is Part A and it is Part B. Part A enrollment is usually, but not always, automatic. So a lot of times people may take, if they're taking Social Security early, like my wife has, when she attains age 65, she will be enrolled in Medicare Part A. But Medicare Part B, you actually have to enroll in yourself, and we'll get into that. And you want to make sure you will enroll in Medicare Part B, that's the medical, on a timely basis, because there can be some downside consequences if you do not. So again, some people are automatically enrolled, those already receiving Social Security benefits and such, and other people may need to enroll. Okay, enroll, and when you're going to enroll, you're going to hear about how you have up to 3 months prior to your effective date for eligibility to enroll. You can go to your local Social Security office. A lot of clergy people that I've dealt with have told me they've done that and actually have had very good and positive experiences. During the Wespath retirement session, there was talk about enrolling with SSA.gov, and of course, there is a phone number there for you to use as well. And again, to take advantage of VIA benefits, you have to be enrolled in both Parts A and Parts B. So how does Medicare work? How does it work in terms of the context of your future coverage? Well, again, there is the original Medicare. That is Part A and Part B, hospital and medical. But it does not cover all things. There are gaps in the coverage that you have. So there are a number of ways, 2 ways in which you can go out through an insurance carrier, get additional insurance to help you cover the costs of those expenses, the cost of those events as they may occur. We're going to talk about the Medicare Advantage with the prescription drug coverage, which is Part C. And we're also going to talk about Medigap, which does not include the prescription drug plan. You would be going to the marketplace to get your own prescription drug plan. So Medicare Advantage Part C kind of bundles the prescription drug benefit in, but with Medigap, they are considered and dealt with separately. And then there also are additional coverages. Medicare does not cover any dental or any vision issues or checkups and providers that you have. Those are going to be additional coverage that you work with VIA benefits to understand how you can get through other insurance carriers that additional coverage. And you also hear about how all of this can actually get bundled together under the Medicare Advantage plan. Stated earlier, there was going to be a slide coming up. There's over 120 insurance carriers that VIA Benefits has a relationship with. Here you can recognize, for the most part, all of those insurance carriers. There are medical insurance carriers here. There are pharmaceutical benefit for the prescription drug plans. They are here, but also many other carriers that are not nationally known but are localized that may come into your analysis as you're working through those. So with those plans, you have Medicare Advantage we'll talk about, the Medigap, the prescription drug plan, the insurance carriers, and then also how all of that can tie together with any dental or vision plans that you also want to receive to have a comprehensive, holistic insurance arrangement for yourself. The Medicare Advantage plans, these are the plans that are bundled with the prescription drug coverage, and these are offered by private insurance companies. Here you have all-in-one coverage. You definitely would have Part A hospital, Part B medical, Part D prescription drugs, but the way these are structured in that private insurance company, in that marketplace, they will often bundle in the additional supplemental benefits that you would be looking for. Dental, vision, hearing aids, even gym memberships. I think they call them silver sneaker benefits. So that all, again, depends upon where you go and how you take advantage of what's available. And again, how it works for you as an individual, you and your household, but you as an individual as well. Because one thing to note is that each individual goes into their own plans with their own arrangements. There are no family plans. There are no group plans. Each one of us is in Medicare on our own. But when you think about financing it, you're thinking about financing it as a household. There are 2 types of arrangements that you can get into with Medicare Advantage. One is the HMO, the Health Maintenance Organization. This is a narrow network of doctors that would be in the network, and it's a narrower range of providers that are within the HMO network. Thing to know about that is you actually have to determine who your primary care physician is going to be. The way the cost can work in an HMO environment is it may be a charge schedule, so certain events, certain types of activity that you have with that provider will have predetermined costs already associated with it that provider has already signed on to, so they know what they're going to receive by virtue of the type of service that they are providing to you. Because you have a primary care physician, if you need to go to a specialist for whatever reason, you will need to get a referral from your primary care physician, and the specialist also needs to be in that HMO network. So it may work for you in your area to be in an HMO. Again, there's no right or wrong answer to any of this, but there is an acknowledgement that is somewhat narrow in terms of the providers that are there, narrow in front of the facilities that may be available as well, outpatient, inpatient type facilities, and specialists. So a really good reason to engage with via benefits. There is also the PPO, the Preferred Provider Organization. This is a much wider network of doctors and facilities that are available to you. You do not have to have a primary care physician. You do not have to get a referral to go to a specialist. Really, the thing here to think about is you want your doctor to be in network. Any specialists that you've used in the past that you may use periodically, you want to make sure they are in that PPO. And again, most really are when it comes to the PPO side. But you do want to make sure they're there. You can go out of network for like a specialist, for example, if you want, unlike the HMO, but it'll be at a higher cost. So just from a cost management perspective, just making sure you understand, like, your doctors and how they'll interplay with each other relative to access and availability in the network of the PPO. And then again, here, other benefits can be provided, the dental, the vision, the hearing aids. It all depends upon how these individual insurance carriers and whomever want to bundle this together and keep it all in one, or still have some separate types of coverage for you for varying benefits. A key feature to know about this is that these are always guaranteed issue benefits. They do not go back and look at any pre-existing conditions and qualify or disqualify or anything like that. You cannot be denied if you're going into a Medicare Advantage plan. Now, with the medical supplement or the medical gap, again, this is where the Part A, the Part B, hospital and medical, is different than the prescription drug plan. They are definitely separate. So this starts with the original A and B, but it does not bundle in the prescription drugs. There would be separate coverage. So you could end up in a situation where you have two plans. The plans that's going to cover A and B, and a different plan, that's how that's going to work. You have a different plan that's going to cover the pharmaceutical, the Part D. You could actually end up with two different carriers doing that as well. And as that might sound a little odd and a little uncomfortable, the fact is that is how you're going to start searching for the most cost-effective way for you to get the benefits that you're looking for. So you could have found an insurance company to cover the Medigap, and then you have a different insurance carrier altogether to cover the prescription drugs. But when you look at it net against the cost on a monthly basis, that is what works best for you. There is no network in Medicare supplements. Pretty much any doctor or facility that accepts Medicare, and most do, is available. Here, your costs, your premiums tend to be a little bit higher, but you have lower out-of-pocket costs. Here, I didn't really mention here how the cost structure might work is you can have a lower premium, but higher out-of-pocket or higher co-insurance deductible type of an arrangement. It is common, not 100%, but it is common that when you enroll in a Medicare, a Medigap, prescription drug, a Medicare supplement arrangement, that the initial premium is due at that time as a part of the enrollment process. So just something to note. Now, these Medicare supplemental policies, this Medigap, these are plans that have been structured by CMS. They have been given an allocation of alphabet letters to determine the plan itself. There's, I think, 10 of them right now. Each plan, Plan A, Plan B, etc., has its own plan design as what it's going to cover. I think Plan G is the most robust plan in terms of what all is going to be covered. But again, it all depends upon you as an individual. So there's varying levels of coverage that are into the different plans that you see. But each one of those plans has to be structured exactly the same. So a Plan A in one state and a Plan A in another state all have to be the same. What the difference is going to be is within the cost structure that's associated with the plan that you choose. So again, you're in a marketplace. There's going to be carriers in the marketplace that are going to provide Plan A plans. But you may find that, and I'm just going to speak in a general sense, there is a large carrier that has a nice economy of scale for Plan A, that your costs, your premium costs, could be lower than a smaller, more modest size insurance carrier, and the premium cost would be higher there. So even if you're looking at, hey, I want a Plan A or a Plan B, you still need to do some initial shopping to determine what is the best arrangement for you, not only from the coverage perspective, but again, from the premium cost perspective, but also looking at out-of-pocket costs in terms of co-payments, deductibles, etc. So you want to continue to keep that in mind as well. Again, these are regulated plans, so there's not a lot of variety per se in these plans. So if you're looking for more variety than what you would see after you've done more research, not this one slide, right, but more research on Medigap plans and these alphabet plans, you may say, well, actually the Medicare Advantage provides for me more options, more flexibility, and more choice, and you go there. But again, you're going to have the ability on your own, but certainly with VIA benefits, to figure out what makes the best sense for you. And then there is the prescription drugs. This is the Part D part of Medicare. Now, all of these plans have the same basic structure, but they can vary in what they cover and what they charge. So they have the same basic type of design, but there is some flexibility for each individual carrier to set up these plans. For example, each individual carrier will have a formulary, the list of drugs that are available to you through that particular carrier. So the drugs that they can fill for you through the plan that you've chosen. But one formulary may decide that drug A is a preferred brand, and the other carrier may say, no, we don't, drug A, we're not there yet. We're going to make it a non-preferred plan, a drug. And that will affect the cost structure that's associated with that particular drug. As you can see here, there are 5 tiers that gets associated with the copays. There is the preferred generic. These are pure generic drugs that have very, very low cost. There's non-preferred generic. So it may not be in that lower cost spectrum right now, but it is still considered a generic drug. So it would still have some more layered or modest costs. There's preferred brand drugs, the non-preferred brand drugs, and specialty drugs. And specialty drugs are the most expensive drugs, throughout all of this complex. Now, how the drug coverage works, and this is how it works in 2024. I think 2025 number is going to be coming. I noticed today Social Security announced there's a 2.5% increase in Social Security benefits for next year. So these all numbers may all be coming in now in real time. The way it works is you have your drug use. The first level is a deductible. Right? So you're paying the full retail price until the deductible is met. Now, when I say full retail price, just please recognize that you're going to be in a group arrangement. So there is still going to be some manufacturing rebates and cost reduction relative to the top tier cost of the drug, but still at the point of sale, whatever that full retail price is after that is what you would pay. And then depending upon the plan, your deductible could be zero, but it can go no more than $545 in this area of the coverage in Part D. And then next is the initial coverage level. So these are the co-pays that you would pay while you're in this coverage. So you've paid your deductible, you've kind of paid it all out of pocket to the $545. Now you're in an arrangement where, depending upon the drug, depending upon the plan, the pharmaceutical benefit manager, and their formulary and tiers, you would then be understanding what your copay would be for that particular drug or drugs. But we are continuing to accumulate what those costs of those drugs are at the overall level, at that discounted level, the manufactured rebates. You're paying the copay, but we are tracking what the retail amount would be, if you will. Once you get to an amount of spend of $5,030, then the coverage gap continues. Now, the coverage gap has often been called the donut hole. When it first came in, I think in the George Bush administration, it was the donut hole. I'm not really sure to what extent we still use it, but it was in the notes I was provided, so it's the donut hole. Here, you're only going to pay 25% for a brand drug, the brand name drug, 25% for any generics that you're using. So again, you're paying at the point of sale a reduced amount against what the actual full retail amount is. That's what you're paying, but we continue to count towards what we call the true out-of-pocket expense, that TROOP. We continue to get that number and accumulate that number. And then if in fact your drug spend becomes greater than $8,000, then you go to that bottom tier, which is the catastrophic coverage. So here you can see in that I don't know, reddish one there, it's only 25% of the people drop into the coverage gap. Here they say about 4% drop into the catastrophic coverage. And what happens here is it says no additional cost for covered drugs for the rest of the year, but there actually is a $9.20 copay for brand drugs and a $3.70 copay for a generic. Generics, again, very, very cheap. And this is on a 30-day supply. So with that $3.70, it's also going to look at what was 5% of that generic, and it's actually going to be the higher of the two. But still, very, very reduced cost at that time. So you kind of like, and this is why it's very important for you to really get that homework done when you're starting to set yourself up for yourself and Medicare, but certainly with VIA benefits, to understand your drug use and then do the research on the formularies with your provider. As far as enrolling in Medicare is concerned, you have a seven-month initial time period to enroll in Part B. Again, Part A, most people are automatically in Part A, get the hospitalization. But Part B, not necessarily do you have to start to participate in Part B. Take a step back. You are going to go into Part B. You have a 7-month period of time. So 3 months prior to the month you turn 65 or retire if you're over the age of 65, 3 months prior to that, you should most definitely get yourself enrolled in Medicare Part B. They know the date that you're actually eligible for the benefits based on your birthday or, again, your retirement, and you'll have that there. There's no delay and there's no break in coverage. If for whatever reason a mistake is made, hey, I'm just turned 65, I'm going into B, or hey, I'm moving on from my employment, I'm going into retirement at 67, 68, now I'm going into Part B. You want to get enrolled quickly, because if you delay the start by 3 months, you don't have any coverage. So the delayed start, as it says there, you can end up with a possible break in your coverage. So you want to make sure you understand this time frame. You have 7 months to enroll. There's a risk if you delay or forget or what have you, because you can end up in a situation where you don't have any coverage and in Part B. And something happens and you're really paying all of that out of pocket. To come back to that middle area there, if you continue, the month you turn 65 or retire, if you continue working past 65 and remain on your employer's group plan, you do not have to enroll during this time frame in this window. So what's happening is you're as you would be with HealthFlex, you're in a group employer provided plan. Our plan provides creditable coverage under law and regulation. And if you are over 65, so you're 68, you're going into retirement appointment, you're ready to go into Part B, you would get from your annual conference a certificate of credible coverage. You would provide that as a part of your enrollment process so they can say, hey, you're 68, but okay, you've been in a credible plan all this time. There is no penalty. You just go in. Again, you want to do it on a timely basis where you don't miss out on coverage, but you don't have to worry about any delay in enrollment and any penalty that may come across from that. Because if, just in the basic scenario, you're going to go into Part B, you have 7 months. Not only did you not get in the first 3 months, not only did you not get in the last 3 months, you haven't gone in at all. There's going to be a Part B late enrollment penalty. And it's 10% on that year's Part B premium that's determined through Social Security and CMS, 10% penalty on that premium. And that 10% penalty is going to get attached to each full 12-month period that you're not in Part B. So if you skipped it for 2 years, it's going to be a 20% penalty on top of what that year's Medicare Part B premium is. And in most instances, that penalty will remain as long as you remain in Medicare Part B. So it's not that, okay, I had the first year or the first 12-month period with this penalty. No, that penalty, and I think it most often will continue to stay with you. Now, this is a little out of scope for our presentation out of Wespath, but there is a special enrollment period. If you find and determine that you qualify for the special enrollment period, again, talking to your local Social Security office, calling that phone number, using VIA benefits even, then there is usually no penalty. But as we know, there's all kinds of different enrollment periods throughout the year. Just want to make sure you are clear as to which one is applying to you at any point in time. So that's just an overview of the basics of Medicare Part A and Part B, the original Medicare, hospital and medical. Then we talked about you have Medicare Part C, which is Medicare Advantage plans, a wider network with some more opportunities to bundle things underneath one insurance carrier. You also have Medigap. Medigap does have a separate, you'll have to get a separate plan for your Part D and anything else you do for vision and dental and all of that. But again, no right or wrong answer here. We just set it all up and you get the premium flow going and you should be all set. And then you have the Part D with the prescription drugs. And all of this is complicated stuff. So, we're just kind of giving you some foundation. Maybe Ivy touches on it a little bit later on, but still you have resources available to you to continue to think through and work through how it affects you. So with VIA, they have a 3-step process that has proven itself effective over time. First step is for you to prepare homework. Look at what type of, you look at your EOBs, right? Your explanation of benefits. What kind of healthcare, behavioral healthcare have you used just the past year, over the last several years? You want to look at your prescription drugs, etc. You want to review that. You want to review that on your own. You want to review that with the VIA benefits advisor. And then you eventually want to enroll. So you have in place the plans and the benefits available to you on that date certain. So to prepare, you want to create an account. And in that account, you want to provide the following information. And by providing more and more information, it narrows the options that would be available to you. But the good news there is it's not narrowing it down in a negative way. It's narrowing it down to really highlight what's in the marketplace available to you. Again, as a consumer in mind, to make the best choices for the coverages that you're looking for. So the first thing is they're going to ask, and you're going to put in your personal information, your name, email, address, telephone number, etc. Now, the information that you provide to them, it is never sold to anybody, and it is never used for any other reason. It is just there on their platform to support your coverage. Your Medicare ID card, again, to be using via benefits, you would have your Medicare card, you have Part A, Part B, etc. There is a number that is there on your Medicare card. You would provide that in your account setup. As I've said a couple of times, you want to understand the prescription drugs that you use. You want to understand the details of those drugs. I was at another event yesterday and I kiddingly said, these are the words that nobody can actually pronounce. So you have to make sure that they are spelt correctly. And then what the milligrams are. What's the dosage that you're using, right? And then the frequency of those medications. You want to get that in there. And then you're also going back to who your doctors are. Who is your primary care physician? Who's the doctor that you go to for your annual physicals? But what other doctors or practices are you utilizing to help you with your overall medical coverage, your overall health care? You want to be able to get all of that in as you're establishing your account. And again, you want to have that kind of narrowed down to your particular situation, but it also allows for the efficiency of the programming behind the scenes to make sure that who you have put in there are in what networks. Okay, so you may get a doctor that's in both the HMO and the PPO under Medicare Advantage, or you may find that the doctors you're using are not available in that HMO. So that, again, that's part of the filtering that will go through with the quality of the information that you provide. And then you'll review your plan options, either online or by phone with a licensed benefit counselor. Really, during the course of the initial introduction of via benefits, we kind of lean more towards using that licensed benefits counselor. If you're completely comfortable doing everything online and you kind of have the understanding of everything, absolutely have at that. It's available to you. I guess me personally, Frank, in a few years, when this would be presented to me, I think my first year I would rely on the counselor and get to know the platform, get to know the system with somebody's helping hand. And then maybe in future years, do my self-service, if you will. But for those, it's available for both. You can do a shop and compare. So this screen is a shop and compare. So now you have input all of the information that is there, everything from your name to the prescription drug dosage that you're using. You can start to embed all of that using the online system. The council will use the online system. And then all of that goes in, and now you start seeing results. And from those results, you're going to be able to sort those results by the cost. You've gone through, you're trying to figure out what the price of this may be by various opportunities that will be presented to you. Again, the plan itself, who the insurance company is that may be providing the package that you're looking for, or insurance companies, because again, A and B and D can be different, but it allows for you to do a side-by-side comparison. This is not enrolling you by going through and doing all of this. It's just a way for you to go deeper into your situation, get some information pushed back out to you, and start filtering things according to your particular priorities. And then also, as I said, you can go online and do it online. Back on this page, there also is or at least on their web platform, there is a My Doctors section. That's also where you would put in the doctors that you are utilizing, the primary care doctor you use, and your specialist. So you want to provide those doctors on that platform as well. Again, just to get all the information out there, to filter it through and get the best back to you. The VIA benefits counselors are licensed benefit advisors. And again, this is all about providing personal support. And again, for Medicare, everybody has their own plan arrangements on Medicare. No family, no group. Doesn't mean you can't be on the same call with your spouse and working it simultaneously. But again, each result will be standalone on its own. They are a 100% domestic workforce. They actually need to be licensed, insurance licensed. Excuse me, just grabbing a bit of water. They have to be licensed and certified by any state that they are providing the services for. They provide objective advocacy. There's no compensate. It's the compensation neutral of plans. So what that means is they don't provide an internal incentive to start to steer their counselors towards moving you into a plan because commissions are kicked off or any kind of other, asset sharing or anything like that can happen. Not going to happen. 100% domestic, licensed by the state. They're working with you objectively to get you the best results. Each one of these counselors or advisors goes through a United Methodist Church cultural training. All of our partners, all of our vendors goes through that training so they understand who we are. And again, they're providing individual telephone support about plans, costs, etc., advice and decision-making support based on your current coverage and future needs. So again, you put in that input, they can see it, and they can start working how that applies going forward. And then they can assist you with enrolling in the medical, prescription, drug, dental, and vision plans. And again, I'll say that this can be done online. If you want to go online, you're comfortable with that, you put everything in, you have the, let's say, your Medicare Advantage bundled together with A, B, and your prescription drugs, you know who you're going to use for vision and dental. Maybe, you have some hearing issues, you have someone there too, and now you're ready to start to enroll. What you would do is kind of like anything else, like Walmart or whatever. You would add to cart. Once you add to cart, you're going to start the checkout. In the lower right-hand corner of the image on the left-hand side, they're now going to walk you through all of the steps you need to make to complete your enrollment. Now, most of the time online, going through that process, everything will be done right then and there. However, there could be circumstances that relate particularly to you where it's going to come back and say, we cannot completely complete the enrollment online. For whatever reason, there's an area that needs to be done offline. You would set up an appointment with an advisor and then complete either paper, but probably online, an additional application to get all of it comprehensively done for you. So most of the time, if you're comfortable online, you can do online. They may kick back and say, oh, this thing got flagged. You just need to do a little bit more work. Again, with VIA benefits, not on your own. And as I indicated, they provide advocacy all year long. They provide help and support. And the help and support feature is not just in that time period of the 3 months in enrollment all year long. And a lot of that help and support is actually done online. They have a robust area where you can get, questions, FAQs, PDF documents, all of that, where you can get the information you're looking for on the fly, or if you just know what you're looking for and you don't need to necessarily get on the line. On the right-hand side, though, as always, there is their business hours, Monday through Friday. I believe it's 7 to 7 Central Time. Those are their business hours. Again, always there for you. You have the shop and compare capabilities and functionality on that platform. You can do the help me choose, where you're looking at the various options that were provided. Your prescription checkup. What really that gets to is over time, prescription drugs may change. Maybe you're not on a particular preventive or maintenance drug, but at some point in time you go on that. You need to update the system. I would do it immediately. I wouldn't wait until you're thinking about it again as you get close to the new year or the new time frame. You want to continue to keep that information as up to date as you can. If for whatever reason the dosage changes, again, you want to just go in and make sure you have done that. If you're happy and comfortable with the plan arrangements that you're in, the decisions you had made some 10 or 11 months prior, your plans will automatically renew from year to year. There'll be no need to re-enroll unless you want to make a change. If you want to make a change, again, we've gone through it. They're there for you, and the online capability is there for you to do the research that you need. Now we're going to talk about the health reimbursement arrangement. Okay, this is a health account that is provided to you and funded by Oregon, Idaho Annual Conference. They will make an annual contribution, and on, I believe, the next slide, we'll explain the contribution, but they will make an annual contribution to this HRA. The dollars that you have in that HRA that gets contributed to you, You do not pay any taxes on that. That's not a taxable event. And as long as you use that account, those dollars to reimburse yourself for eligible healthcare expenses, then they won't get taxed on that. Then you can come out and get that money cleanly. Again, no taxes from taking it out and reimbursing yourself. How these arrangements work is it is a reimbursement account. So it gets funded, you have the activity, then you go and get the reimbursement. You can't kind of front load something to a doctor or a specialist from the HRA. It has to happen as a reimbursement. So you're paying yourself first, you're providing a receipt, and you're getting yourself reimbursed. Now, funding to reimburse yourself can be applied to eligible premiums as well as out-of-pocket expenses across the board: medical, prescription, dental, and vision. But again, for all of that, you have the event, you get the appropriate documentation, then that you are reimbursing yourself from that HRA account. Each year, the HRA does get funded. If you do not use all of what's in your HRA in a given year, that will roll over to the next year. So the HRA funding is available. It's available as the date you enroll. So it's not coming to you on a monthly basis. The amount that you're going to see will be provided to you in and of itself. And if you don't use it all, whatever is left in that HRA will roll over into the next year. So that amount just goes to the next calendar year with that year's contribution being placed on top of it. So it can be if you're a low utilizer of these types of things, then it becomes kind of like a savings account, if you will, where it will grow, not invested, but it doesn't just go to zero 1 year over the next. That amount will roll over for future use. This is the 2025 funding, and this is based on years of service. So I think I said it when I was able to talk during the Wespath piece. Your clergy service record, your years of service, you want to make sure that's in good working order, because it's not just about the CRSPDB. It can also be about eligibility for the funding. So if you have 10 years of service, you can see it's 1,044. If you're married, it's the 1,566. Moving down, 20 years, 1,392, 2,088. And then for 30 years, 2,000, I might be a typo, 2,088, and then 3,132. I might have had a typo when I transposed that. The asterisk there, you have to be married at the time of retirement for the you and spouse amount to be provided. If you have a health reimbursement arrangement now, they do not get combined. They remain as separate accounts, so kind of mutually exclusive, if you will, but you'll still have the ability to use the HealthFlex HRA and get reimbursements from that as you can your HRA that you're going to get in retirement. Okay. To get that HRA, you must enroll through via benefits to get that HRA. I think there may be a couple of exceptions to that around PERS and TRICARE, things like that, that may be specific in your state or in your environment. But as a general rule, you enroll through via benefits to get that HRA. Now, there's a couple of ways in which the reimbursement can work for you. Here you're getting reimbursed for maybe a premium or maybe a service that was provided. You're going to have to pay that premium. You're going to pay the bill for that service. Then you're going to provide that to the insurance carrier. The insurance carrier or service provider will then submit the information on that down to Via Benefits. Now that Via Benefits has the documentation for the event that is already captured, they will then reimburse you back into your account through direct deposit. So you're having the service, you're working through the carrier, working through Via Benefits, you're getting that reimbursement. So $50 premium comes back to you within several days after you initiate that. Now, for the direct deposit availability, so here in your setup, you are providing your banking information, right? Because you want to do direct deposit. So just like with the the annuities and the income you're going to get from Wespath, you would provide your banking information. Here, though, in the setup of this could take upwards of 6 to 8 weeks with all the players that are involved to get it completely set up. So just kind of setting an expectation there. But then thereafter, the process will go smoothly. And again, you can be reimbursed up to the amount that's available in your HRA. Now, another interesting way in which you can get the reimbursement is through an automated reimbursement process, but this is just for your premiums only. So you know what your premiums are. What you would do is set up with your bank again, you're working with your bank to have them automatically send to your insurance provider or providers, depending upon the arrangement, what your premiums are. So that's going to go to the insurance provider, the insurance carrier. That carrier will then provide a receipt to Via Benefits, and then Via Benefits will reimburse you through direct deposit. So now this is a nice, clean, and easy way for you to set up just your premium flow during the course of the year. And again, this one also takes about 2 or 3 months to set up, but that doesn't mean that it's only for that purpose. So you have, the $1,000 in your HRA, of which $800 is going to be that premium flow as you go through. Well, you can use that $200 to reimburse yourself using this process as well. So they can work in tandem. But I like this process. Again, I'm a few years away from it, but that would be certainly something I would be considering doing. Again, Via Benefits, they are there when you need them. You can use them online. Online information is available 24/7. They are available, 8 to 9 p.m. Eastern time with that 866 phone number. You'll have access to the portal, myviabenefits.com/Wespath. And you'll access that. You'll access your account. The 3 service centers you can see there on that map that are in Salt Lake City, Phoenix, and Dallas. Those are the service centers. But again, wherever you're dealing with a licensed and certified state-specific type of individual, they're all going to be covered. Where regardless of what state they're sitting in, they will have the appropriate other state licenses at their disposal. And every year, continuing education, they got to keep that up. So that concludes this part here. I will come back on screen if I can. Okay. And were there any questions that came in? I will try to see what has happened. Okay. Looks like Meg, you were, if you're there, Meg, looks like you were kind of handling those as they were coming in. And I appreciate that. And there were 3 questions that came in. I'm not sure. Okay, so let me take a look at this. As a clergy couple, do we get individual contributions or married? So I don't know, Meg, if you had an opportunity to look at that. And is an HRA similar to an FSA? FSA cannot be used when you qualify or sign up for Medicare. Is that correct? The FSA is different than an HRA. An HRA is the plan sponsor providing a contribution into the account. The FSA is funded through pre-tax dollars coming through your payroll as a W-2 employee. So you have an FSA account. It's limited in how much you can roll over from 1 year to year, but eventually that FSA account will not be available to you, especially in retirement, because you're no longer eligible for the FSA because you're no longer an employee with W-2 earnings. Okay. Where again with the HRA, the way this is set up for you in retirement, you'll continue to get those contributions through the year. So I hope that helped with the question that was provided there. So if there's no other questions, Meg, if you want to come back on, I believe we're now going to take a lunch break.
Hi, yes, we're running a little bit behind. So Ivy's scheduled for 12:45, but so I'm thinking closer to 1 probably. Maybe take a half-hour lunch.
And Ivy's coming on at that time?
Well, she's supposed to at 12:45, so
Oh, okay.
maybe 5 of 1.
Okay. So all right. Okay, I just wanted to make sure I understood.
Take a
Because again,
lunch.
time zones, I'm a little confused. I will keep this up and running. Bob will keep his up and running. I got through that, thank God. So we're okay, and hopefully that was helpful. And again, this recording will come back out. And any additional questions you have, you can certainly send to Meg, to me, and we'll do our best to get you those answers as quickly as possible. So I'm going to stop sharing, which I probably should have already done, and then come back. Well, I mean, again, I'll be here behind the scenes when Ivy gets started.